A sickle scaler is a periodontal instrument used to remove calculus deposits from the crowns of the teeth. Sickle scalers should not be used on root surfaces. The working end of a sickle scaler is triangular in cross-section. This design limits its use to supragingival instrumentation. It has a pointed tip and 2 cutting edges per working end. The face is perpendicular to the lower shank so that the cutting edges are level with one another. Level cutting edges mean that the lower shank must be tilted slightly toward the tooth surface to establish correct angulation. Technique practice: sickle scaler on anterior sextant. As an introduction to using a sickle scaler on the anterior teeth, first practice on the mandibular left central incisor facial aspect. Before beginning, take a moment to self-assess your position and your patient's position. Correct them now if needed. Throughout this technique practice, stop every so often to reassess position and grasp and correct them if necessary before proceeding. Position the working end near the midline of the left central incisor. Establish a 70 to 80 degree instrument to face-to-tooth surface angulation. The tip should be aimed toward the mesial surface of the tooth. Use overlapping strokes as you work across the facial surface in the direction of the mesial surface. Roll the instrument handle slightly between strokes to maintain adaptation. As you approach the mesiofacial line angle, roll the instrument handle to maintain adaptation of the tip third of the working end. Continue making strokes as you work your way along the mesial surface. Check to make sure that you have maintained an angulation of 70 to 80 degrees. Continue strokes until you work at least halfway across the mesial surface. The other half of the mesial surface will be instrumented from the lingual aspect of the tooth. Technique practice: sickle scaler on posterior sextant. As an introduction to using a posterior sickle scaler, first practice on the mandibular right first molar. Before beginning, take a moment to self-assess your position and your patient's position. Correct them now if needed. Throughout this technique practice, stop every so often to reassess position and grasp and correct them if necessary before proceeding. First, select the correct working end. Use a tooth that is easily seen, such as the first premolar. Establish a finger rest and randomly place one of the working ends on the distal surface. Study this working end. Note that the lower shank is not parallel to the distal surface. Also, the functional shank is down and around the tooth. This is the incorrect working end. Look at the opposite working end. Note that the lower shank is parallel to the distal surface and the functional shank goes up and over the tooth. This is the correct working end. Begin at the distofacial line angle. The tip should aim toward the back of the mouth because this is the direction in which you are working. Work around the line angle and on the distal surface. Work at least halfway across the distal surface from the facial aspect. Pause to check your angulation. Remember that the sickle's face is at a 90-degree angle to the lower shank. If the lower shank is parallel with the distal surface, the face-to-tooth surface angulation is 90 degrees. The lower shank must be tilted toward the distal surface to establish correct angulation of between 70 and 80 degrees. While maintaining your fulcrum, lift the working end away from the tooth and turn it so that it aims toward the front of the mouth. Reposition the working end at the distofacial line angle. Work across the facial surface. As you approach the mesiofacial line angle, roll the instrument handle slightly to maintain adaptation. Tilt the lower shank slightly toward the mesial surface to maintain correct angulation. Work at least halfway across the mesial surface from the facial aspect. The other half of the mesial surface will be instrumented from the lingual aspect.
This is the mirror fulcrum for We're using the posterior sickles on the maxillary right posterior area. We retract the buccal mucosa like this, or we can simply retract without the fulcrum on the teeth if that's better for you. Usually we like to have the mirror facing the teeth so you can see those buccal surfaces as you instrument the teeth. I'm going to remove that now so that we can see the fulcrum for this area. Using a modified pen grasp with this 204S sickle, I'm going to establish a fulcrum on the occlusal surface of the first molar, and let's start on the second molar distal here. And we're going to do a series of vertical strokes on the distal 4S. We'll go to the mesial and then do a series of mesial strokes here with this 204S. Let's move to the distal of the first molar, and now let's get a close-up of working in this area. Here's a close-up of the 204 posterior sickle. We're going to adapt to the distal and do a few strokes on the distal. This is a supragingival instrument. And then we're going to adapt to the mesial and do the mesial surface. Now you have the option with this instrument of just doing the mesial and the distal on each tooth, doing mainly proximal surfaces, or you can choose to also use this on the buccal with overlapping strokes and then rotate it around. Now right here it's difficult because of the angulation to rotate without poking into the papilla, so you may wish to just use it for overlapping strokes here and then stop and then reposition your instrument before you do strokes on the mesial or on the distal. So let's practice both. You can try practicing buccal strokes, but this 204S has a very right angle bend in the shank, so it's difficult to manipulate this around the line angle. So consult with your instructors to decide whether you should just use this on the mesials and distals or whether you should also try to use it on the buccal surface. So right here at the mesial line angle, you can either rotate very acutely to go into the mesial, or as you come here you can stop, take it out, and then reinsert it so that you don't traumatize the tissue. So let's do one more tooth. We'll do the distal, and then we'll do some buccal strokes here, very short controlled buccal strokes, and then I'll just take it out and then go into the mesial. Here's a close-up of a 204 type posterior sickle scalar. You could have a 204SD or a 204S, and we'll go rotate around and come into the mesial like this, and then adapt and do the distal. Now, with a 204S, there's an acute angulation, so you might just want to do the distal and then simply go in to do the mesial like this. But if you have this type of, this is a 204SD, the blade is a little more forgiving here for the buccal surface. It's a little easier to adapt to the buccal, so I can do the buccal and rotate around and also do the mesial. Now this is mainly a supragingival instrument. You might go a little bit subgingivally, but it's a very sharp angular blade with a very sharp point. So right now we're just going to use it on the crown of the tooth supragingivally. On the typodont, just work on the white enamel of the typodont. And if you're working with a partner, stay supragingivally coronal to the marginal gingiva, or you could go slightly under the gingiva, probably on the proximal surfaces as you go to the contact point. I'm holding the Nevi 3 scalar with a modified pen grasp. I'm using a firm grasp, and I'm going to establish a fulcrum on the occlusal surface of the first molar, drop the handle a bit to adapt this to the distal, and we'll do distal vertical strokes going across the distal surface. We'll adapt this to the mesial and do a few strokes here on the mesial, overlapping strokes across the mesial surface. Now we can also use this to do the distal of the next tooth, and then we can rotate this with our thumb to adapt it to the buccal and do overlapping strokes on the buccal and then rotate around and do the mesial. Let's take a close-up look at this NEVI 3 instrument. Here's a close-up of a NEVI 3 posterior sickle scaler. This is a Montana Jack type scaler that's curved and double-ended. We're going to do overlapping strokes across the buccal and then rotate with the thumb to keep the tip on the tooth to go into the mesial. Now we can use the opposite cutting edge and adapt it to the distal, and we do a few strokes on the distal. Let's do the distal first here. We're going to adapt to the distal. We're not going to go very deeply subgingivally with this, and we'll do the distal, and then this is a supragingival instrument, so we start at the marginal gingiva or near the CEJ on this typodont tooth and do overlapping short strokes, keeping the tip against the tooth, and then we go down to the contact area. We'll do the premolar now. Get your fulcrum, adapt the opposite cutting edge, make sure the very pointy tip is against the tooth, and you use your fingers to control that. Then we come out, adapt to the buccal, do short overlapping strokes here on the buccal. Your thumb rolls against your fingers to keep it adapted on the mesial. And then we'll do the last tooth, the first premolar, adapt the opposite cutting edge, do some distal strokes here, and then come out, readapt to the buccal, and do oblique diagonal strokes across the buccal, rotate into the mesial. Here's the mirror fulcrum for using the posterior sickles on the maxillary left lingual. We can fulcrum on the upper teeth and adjust the mirror. We're using this mainly for illumination to get extra light in the area, because usually from a 9 o'clock position we can get pretty good direct vision of the tooth surfaces. So I'm going to take this away now so that I can show you the correct fulcruming for the 204 sickle and the NEVI 3 in this area. This is the modified pen grasp for the 204S sickle, and I'm going to establish a fulcrum, an intraoral fulcrum on the occlusal surface of this first molar. Here's the 204S sickle. I'm going to do distal strokes on the distal of this molar, and then we'll adapt it to the mesial. We're not going very subgingivally with this. It goes a slight bit subgingivally. We're working mainly from the CEJ down, and this is just to remove calculus that's just under the tissue. If it's very deep, there are other instruments that you might want to use that are a little more effective for deeper calculus, and practice this on the mesials and distals of all these molars. Now, I'm having a great deal of difficulty with an intraoral rest here, so you can use an extra or mandibular rest if you rest on the lower teeth here. Let me just show you how you can adapt this instrument. I'm using a lower rest now on the mandibular teeth, and it makes it much easier to get good strokes with this instrument. And we're going to lift up a little bit. I'm resting on the mandibular premolars in order to get better adaptation of this 204S. Here's a close-up of a 204 type posterior sickle. I'm going to start at the distal line angle and do overlapping oblique strokes, rotate around the mesial line angle, and do vertical strokes on the mesial. Now I'm going to adapt the opposite cutting edge, the inner cutting edge, to the distal, and we'll do some distal strokes. We're working mainly on the enamel here. This sickle scaler is a supragingival instrument, but you may be going just a little bit subgingivally on these proximal surfaces. And then on the lingual, we go again, mainly supragingivally on the lingual, do overlapping strokes here, and then rotate around, come into the mesial. We'll do the premolar here by lifting up, adapting the blade, and doing overlapping strokes on the distal. And then we'll readapt so that we can do the lingual surface, and then rotate around to the mesial and do all the teeth in this sextant. Here's the modified pen grasp with the Nevi 3 scaler, and I'm going to establish an intraoral fulcrum on the first molar and adapt it to the distal. We'll drop the handle to do the distal of the last molar, or the second molar here, and then we'll go to the mesial of the second molar, do vertical strokes coming down, go halfway across the mesial surface. We'll move the fulcrum forward and then do the distal of the first molar here, and then come out. Rotate the blade with your thumb, and then you can also do oblique strokes on the lingual and then rotate around to do the mesial. So you can do the distal, the lingual, the mesial with this instrument, or you can just limit it to supragingival scaling on the proximal surfaces, on the mesials and the distals, like this. Here's a close-up of a Nevi 3 scaler. It's a Montana jack type design, double-ended, curved posterior sickle. We'll rotate this around, do the mesial. Now adapt the inner cutting edge to do the distal surface. We'll do the next tooth and adapt to the distal line angle. Drop down a little bit to adjust your angulation as you do the distals, and then readapt to do the lingual. Do overlapping strokes on the supragingival, on the crown, on the lingual, and then rotate around, continue to scale the crown of the tooth to the mesial. Now we'll lift up a little bit to do the distal of the premolar, and then we need to do the lingual of this premolar, so we'll readapt the blade and do short overlapping strokes on the lingual, and then rotate around, stay on the enamel, and then we'll do the mesial surface. Continue to do all of these teeth in the... I'm coming in from a 9 o'clock position to retract the cheek with a mirror so that I can use the posterior sickles on the maxillary left posterior area. I'm going to take the mirror away so that you can see how I establish a fulcrum and work with the 204S sickle. Close-up of the 204S sickle. This is a posterior sickle. I'm going to adapt it to the distal of the second molar, and we'll do overlapping strokes. We use this mainly supragingivally, or about just at the CEJ or slightly under the CEJ, with overlapping strokes. I'm going to adapt it to the distal now of this molar. You can see how you keep the lower shank either parallel or you cross over just a bit to get an 80-degree angulation with this instrument. And we'll go to the mesial. Cross over just a little bit to get that 80-degree angulation, and we use an intraoral rest. Practice with this instrument on all the teeth in this sextant. Here's a close-up of a 204 type posterior sickle scaler. I'm going to adapt at the distal line angle and do a series of overlapping strokes, supragingivally on the crown, and then at the mesial line angle we rotate and do mesial strokes down to the contact. We're going to adapt this to the distal now. It's the opposite cutting edge, and then we do just a little bit of enamel here down to the contact point. Let's do the next molar. Adapt to the distal with the opposite cutting edge. Rotate to make sure the tip is against the tooth. Lower shank should be close to parallel to this distal surface, and then we'll do a series of overlapping strokes to the contact point. Now come out, readapt at the distal line angle, and do overlapping oblique strokes across the buccal, and then rotate around to do the mesial. Make sure that you close your angulation down a little bit and come down to the contact. We'll readapt on the distal, lift the handle up a little bit, rotate with your fingers to make sure this very sharp point is against the tooth as you do overlapping strokes to the contact. And then we'll come out on the buccal again, adapt, and lower your handle so that you can do more of an oblique stroke here across the buccal. And then do overlapping strokes again to the contact, and do all the teeth in this sextant. I'm holding the Nevi 3 scaler with a modified pen grasp, and I'm going to hold this firmly and then establish a fulcrum on the occlusal surface of the first molar, and then reach back here to the distal of the second molar. Lower the handle and the shank a little bit so you can get this in a good 80-degree orientation. Get the blade at an 80-degree angle to the distal surface. Then drop down with the handle to adapt this to the mesial surface, and we're working mainly supragingivally on these teeth. So we're scaling the enamel. We might be going just a little bit under the tissue. Now with this Nevi 3, this one is easy to rotate around and adapts quite nicely to the buccal surfaces here. It will also adapt to the lingual. Rotate very carefully at the line angle and then go into the mesial. Now, because you're a beginner, if you are a student, it's very difficult to negotiate this turn, so you may wish to just do overlapping oblique strokes and then stop there, take it out, and then readapt it to do the mesial. Let's take a close-up look at this instrument. Here's a close-up of a Nevi 3 posterior sickle scaler. I'm going to adapt at the distal line angle and do a series of short overlapping oblique strokes across the buccal, and then rotate around the line angle and do vertical strokes all the way across the mesial and down to the contact point. We're going to readapt this by lifting up the handle, and then we'll go into the distal area, and we're scaling with the opposite cutting edge and advancing toward the lingual. We'll come out and reinsert and stay fairly supragingivally, but on a distal or a mesial surface. On the proximal, you're going to go a little bit subgingivally with this. Scale to the contact point. Now we'll readapt this on the buccal and then do overlapping strokes, oblique overlapping strokes on the buccal, rotate on the mesial, and then do vertical strokes all the way down to the contact. Now we're going to readapt to the distal of the premolar. Lower your handle a bit so that the tip will go a little bit deeper and across, and then we'll come straight down to the contact. Now we're still on the enamel. We're just supragingival. We'll do oblique strokes and then rotate around and do vertical strokes to the contact. Do all the teeth in this sextant. I'm sitting in a 9 o'clock position, and now I'm establishing the mirror fulcrum for the maxillary right lingual surfaces. We're going to use the mirror like this for indirect vision and also for illumination for the 204S sickle, and I'm going to remove the mirror so that you can see my fulcrum with the sickle. I'm coming in from a 9 o'clock position, and I'm going to hold this 204S sickle with a modified pen grasp and get a good occlusal fulcrum up of the 204S posterior sickle. I'm going to adapt it to the distal of this second molar and do some vertical strokes. Come out, adapt it to the mesial, and then we'll do vertical strokes We do these strokes mainly on the enamel, mainly in a supragingival area, but here on the interproximal, this is going to go slightly subgingivally, and we want to use this to remove calculus that's just under the tissue or on the supragingival surfaces. Practice this instrument on all of the mesial and distal surfaces in this sextant. Here's a close-up of a 204 type posterior sickle. We're going to start at the distal line angle and do a series of overlapping strokes on the enamel. We're doing supragingival scaling strokes here, and we're coming around the mesial with overlapping strokes. Now we come out and then readapt to the distal, and we're going to use the opposite cutting edge, the inner cutting edge here, to do strokes across the distal. Now we'll do the distal of the next molar, adapt the tip, do very short overlapping strokes. We're just working mainly on the enamel here, so we'll be a little bit subgingival on a real patient, just a slight bit, and then we'll start again on the enamel here, supragingivally on the lingual. Rotate with your thumb and your fingers to go around the line angle and do overlapping strokes across the mesial surface. Now we'll come out and readapt this blade to the distal. You'll notice that if you're almost parallel or just leaning a little bit into the crown of the tooth, you'll have good working angulation. Now adapt to the lingual again, and then do oblique strokes across the lingual. Rotate with your thumb and your fingers. Keep this pointy, sharp tip adapted to the mesial, and come down to the contact. Do all the teeth in this sextant. I'm coming in from a 9 o'clock position. This is the Nevi 3, and I'm using a modified pen grasp. I'm going to hold this instrument firmly as I establish a firm fulcrum on the occlusal of the first molar. I'm going to adapt this to the distal and do vertical strokes on the distal surface, and then I'll come out and adapt to the mesial, and we'll do vertical strokes coming down on the mesial. Now this is a little awkward, so I'm going to move my fulcrum forward just a bit so I can do that a little better. And then we'll do the distal, adapt to the distal of the first molar. These are supragingival strokes on the enamel. This is a very sharp pointed instrument, so you need to control this very carefully. Insert on the mesial and come down to the contact. This instrument can also be used on the lingual. Rotate this around with your thumb, and then you can start at the distal line angle and do supragingival strokes on the lingual, overlapping strokes to the line angle. Now if you can do this, you can rotate it and come around to the mesial and do strokes on the mesial. But if that's awkward for you and you're just beginning to use this sharp instrument, pointed instrument, do oblique strokes on the lingual and then come out and readapt, reposition your blade, and then do the mesial strokes here to protect the tissue. Let's take a close-up look now at this Nevi 3. Here's a close-up of a Nevi 3 scaler. This is a posterior sickle, and we're going to start at the distal line angle and do oblique supragingival scaling strokes on the crown and rotate with the thumb, come around to the mesial, and now we're doing mesial vertical strokes to the contact point. We'll readapt at the distal line angle and then go into the distal, scale with the opposite cutting edge. Now let's readapt to the distal of the molar, the first molar, and we'll rotate around and use the inner cutting edge or the opposite cutting edge to scale the distal surface to the contact. Now we'll come out, readapt to the lingual, start around the distal line angle, and then we'll do controlled oblique overlapping strokes on the lingual. And then when you get to the mesial line angle here, use your thumb to rotate the tip. Keep the point against the tooth and against the enamel as you do overlapping strokes down to the contact point. On the premolar, this is a much smaller tooth, So adapt, make sure the point is against the tooth, do strokes on the distal, and then come out, readapt to the direct lingual, and do oblique overlapping strokes on the lingual, and then rotate around. I'm sitting in a 9 o'clock position, and here's the mirror fulcrum for scaling the mandibular right posteriors with the posterior sickle scaler. So we can use a mirror fulcrum like this on the teeth, on the maxillary teeth, or we can simply use a modified pen grasp and retract the cheek like this, or retract the cheek and use the mirror to view the buccal surfaces. I'm going to take the mirror away now. Here's a close-up of a Nevi 3 scaler. This is a posterior sickle. You could also have a Montana Jack type scaler. Use an overlapping stroke, rotate, come into the mesial, and do overlapping strokes. Now we're going to use the opposite cutting edge, the inner cutting edge, to adapt to the distal, and we'll do some strokes on the distal. We're working supragingivally here, so you're going to adapt to the distal, do a few strokes here. We're not going very far subgingivally. You may have to go a little bit subgingivally with this instrument. If the tissue is loose, you can go a short distance, but otherwise we're going to do overlapping supragingival strokes and then rotate around here onto the mesial. Now, it's sometimes, if it's difficult to negotiate this mesial line angle, you can stop here and take this out and then readapt it at the mesial if you wish. Ask your instructors if they would like you to just do mainly mesial and distal surfaces with this posterior sickle, or if they would like you to also practice doing the buccal and the mesial. You have to hold this very closely with an intraoral rest and keep the pointed tip. This is a sharp blade, so you want to keep it on the tooth as you work. And then when you do the buccal, make very, very short controlled strokes and keep it on the tooth the whole time. To approach with the posterior sickles on the lingual of the lower left, we need to establish a fulcrum for the mirror on the maxillary arch like this, and then retract the tongue with the mirror. I'm going to remove this so we can establish a fulcrum with the 204 sickle, and we come in like this, and then let's take a close-up look at the fulcrum for this instrument. This is the fulcrum for the 204S posterior sickle. We have a built-up fulcrum, and let's zoom in so we can see how this works. Strokes, and then I'm going to come out and adapt it to the mesial of the molar and do overlapping strokes on the mesial. Now we'll take this blade. It's very sharp, so make sure that it's rotated so that the tip is against the surface as you do these vertical strokes. And keep this lower shank roughly parallel, but it's also going to cross over a little bit like this to close the blade up to the optimal 80-degree angulation with this sickle. And then we'll do the distal of the premolar. Practice with this 204S on all of the surfaces in this sextant. Here's a close-up of a 204 type posterior sickle scaler. We're going to adapt this to the lingual, do overlapping strokes, very close overlapping strokes on the lingual, and then rotate around the mesial line angle to do vertical strokes on the mesial. We're going to adapt to the distal. This is the opposite cutting edge. We're staying pretty much supragingivally here, but on the mesial and distal, you'll go slightly subgingivally as you use this. So we're going to do the distal first here, and then we'll come out and then do overlapping strokes again on the lingual, rotate around, and do the mesial. Now, sometimes you can use this instrument and just do the proximal surfaces, just do the distal and then come out and readapt and just do the mesial sometimes this instrument is just used to do supragingival scaling or scaling just under the tissue on the enamel, and the linguals will be scaled with another instrument. But you can use it in an oblique stroke like this on the lingual and then rotate around and do your mesial as well. Continue to do all the teeth in this sextant. Here's a close-up of a Nevi 3 posterior sickle scaler. This is a curved double-ended sickle that's very much like a Montana Jack sickle. And we're going to come around with overlapping strokes on the lingual, rotate around the line angle with the thumb, and then we'll do overlapping strokes on the mesial. Now we'll take it out and use the opposite cutting edge to adapt to the distal, and we'll do overlapping strokes on the distal. This is a supragingival scaling instrument, but when you go interproximally like this, this will go slightly subgingivally under the contact point. So you want to make sure that when you're using this, you are adapting this very carefully so that the sharp tip and the sharp cutting edges are against the tooth. Do short overlapping strokes on the enamel, rotate around, and do overlapping strokes to the contact point. On the premolar, this is a very small tooth. Adapt the opposite cutting edge, do overlapping strokes on the distal, come out, and then when you do the lingual and the mesial, make sure that you do oblique strokes like this to protect the tissue, rotate around, and then do oblique or vertical strokes by rocking back on your fulcrum up to the contact, and do all the teeth in this sextant. In a 9 o'clock position, and this is the mirror fulcrum for working with the posterior sickles on the mandibular left side. I'm going to retract the cheek like this, and I can use the mirror to view the buccal surfaces of these molars. I can also just retract without fulcruming on the upper teeth if I want to just hold this with a modified pen grasp and view these buccal surfaces. I'm going to take the mirror away now, and then I'll do the distal of the second molar, and then we'll come out and adapt this to the mesial, and we'll do the mesial. Make sure that this lower shank is placed so that the angulation is about 80 degrees as you're doing the surfaces, at least halfway across the surface. Come out, and then we're going to adapt it here and do the mesial. So do all of the teeth in this sextant. Here's a close-up of a 204 type posterior sickle. We're going to start at the line angle here, and we're going to do overlapping supragingival strokes on the enamel. We rotate with the thumb and the fingers to come around on the mesial, and we do overlapping short strokes to the contact. Now I'm going to come out and readapt this to the distal, and we're going to use the inner cutting edge, the opposite cutting edge, to do short overlapping strokes up to the contact. We'll do another distal. Now when you do these distal surfaces, even though you're on the enamel here, once you go interproximally, you're going to be a little bit subgingival. So do overlapping strokes like this into the distal. Now we're going to come out and do buccal oblique strokes again across the buccal surface. Overlapping strokes, rotate right on the line angle, and then make sure that you're doing really good overlapping strokes. Keep the tip against the tooth on the mesial. Now we'll do the distal of the premolar. Adapt, rotate this around, and lift the handle up to make sure the tip goes across as you do these overlapping careful strokes on the distal. Now we'll readapt on the buccal, and now instead of doing a straight horizontal stroke with the toe down, Try to angle this so you can do oblique strokes or diagonal strokes across the buccal, and then rotate around and do vertical strokes on the mesial. I'm sitting in a 9 o'clock position, and this is the mirror fulcrum for retracting the tongue and getting vision and illumination into the area on the lingual of the mandibular right molars. I'm going to take the mirror away now and show you the fulcrum with the 204S sickle. I'm holding the 204S with a modified pen grasp, and I'm going to establish a fulcrum here on the lingual cusps. I'm going on the lingual aspect of these lower right posterior teeth. I'm going to fulcrum more on the lingual side of these premolars to reach back to the distal of the first and second molar. Here, we'll insert this, and this is doing supragingival strokes. Now, when we go on the proximal surfaces here, just try to work mainly on the enamel above the CEJ. You will be subgingival on many patients if the tissue fills the interproximal space, that you'll be slightly subgingival with this instrument, but you just go down and go just on the enamel. Do overlapping strokes. Do all of the teeth in this sextant. Here's a close-up of a 204 type posterior sickle. I'm fulcruming on the lingual of the cuspid premolar area on this lower right lingual, and we're going to start toward the distal line angle and do overlapping supragingival strokes on the enamel of this tooth. We're going to rotate around the line angle to do mesial strokes, again just on the enamel of the tooth here. We'll come out and readapt the inner cutting edge or the opposite cutting edge on the distal, and then we'll do overlapping strokes on the enamel on the distal. We'll readapt on this first molar, adapt the opposite cutting edge, and then do overlapping vertical strokes up the distal surface and go across the distal surface. Now we'll readapt this blade so that we start toward the distal line angle on the enamel and do overlapping supragingival strokes very carefully here. When you get to the mesial line angle, rotate using your thumb and your fingers, and then make this lower shank parallel, or you can lean a little bit into the tooth by lifting the handle, and then do overlapping strokes on the mesial to the contact. Now I'm going to adapt to the distal of the premolar, and we're on the enamel again. When you go interproximally here, or into the distal or the mesial, you'll be slightly subgingival. Go to the contact, and then here we're going to readapt, and starting toward 8 to 9 o'clock position, I'm going to retract the upper lip with my index finger and thumb. I have the H67 sickle, and I'm using a modified pen grasp with this instrument and establishing a fulcrum right here. It's really toward the facial of the cusps on these premolars. We're going to come in from an 8 to 9 o'clock position and do the surfaces toward me. So we start at the midline, rotate around the line angle, do overlapping supragingival strokes on the enamel. We'll start at the enamel right in the midline here, do overlapping strokes. You see how I'm just keeping the first millimeter of this in contact with the tooth, the first third of the tip or so down to the contact. We'll do one more. So we start with just 1 or 2 millimeters of this contacting the tooth. That's all that ever contacts the tooth while you're scaling. And then you come down on the mesial to the contact point. Here's a close-up of an anterior jaquette type sickle, and we're going to start on the facial at the midline and do the surfaces toward us. I'm rotating with the thumb to keep this against the tooth and We're staying on the enamel supragingivally to the contact point. We'll start on the next tooth near the midline, do short overlapping strokes, rotate around the line angle, and do overlapping strokes down to the contact point. On the next tooth, again, start near the midline, overlapping short strokes, rotate with your thumb to keep the tip, the sharp tip. Coming in from a back position, 12 to 1 o'clock, and I'm going to retract the upper lip with this index finger. I have the H67 sickle scaler, and I'm going to establish a fulcrum on the occlusal and incisal edges of the premolar and canine area here. I have a modified pen grasp. Let me readjust to make sure I'm on the side of my middle finger here. Here's a close-up of the H67 sickle. I'm in a back position and I'm going to do the surfaces away from me. Starting at the midline with the first 2 millimeters of this blade, I'm going to rotate around, keep this very large blade against the tooth on the enamel as you come down to the contact point. We'll start on the facial of the next tooth, do very, very short overlapping strokes and keep the point against the tooth. You don't want to be off on a tangent or into tissue as you're working with this instrument. And we'll go and do the last tooth. Stay on the enamel supragingivally, go around, and then come down to the contact point. Here's a close-up of an anterior Jacquet sickle. I'm in a back position doing the surfaces away from me. Starting at the midline of this canine, we're going to rotate around, do the mesial of this canine on the right side, and then we'll do the next tooth. Start at the midline, do overlapping short strokes. These are supragingival strokes on the enamel down to the contact point. We'll do one more. Start at the midline, overlapping strokes using the first 2 millimeters or so of this blade. Go around the line angle. I'm sitting in an 8 to 9 o'clock position, and I'm going to position the mirror because we're going to scale the surfaces toward us, starting on the mesial of the left canine, and I'm using the H67 sickle scaler. We get a fulcrum on the buccal occlusal surfaces of the premolars, and then we're going to just go supragingivally with this sickle scaler and adapt it to mainly the mesial surfaces over here, but you could start toward the lingual and then rotate around and then come into the proximal surface. Keep your handle roughly in line with the long axis of the tooth, but you're going to cross over a little bit to close the angle down to about 80 degrees. Here's a close-up of the H67 sickle scaler. We'll start at the midline, and we're doing surfaces toward us on the upper anteriors. And these are just supragingival strokes on the enamel. Starting at the midline, rotate around, keep the tip of this on the tooth at all times, and do overlapping strokes to the contact area. Start again on the midline. So we're doing all the surfaces toward us on the maxillary anteriors, supragingival strokes on the enamel, and do all the surfaces toward you. Here's an extreme close-up of a small Jacquet sickle. We're doing the surfaces toward us on the maxillary anteriors. These are supragingival strokes on the enamel. And we'll go to the next tooth and start near the midline here and do overlapping strokes. Rotate very, very carefully with your thumb to keep the tip of this, the very sharp tip, adapted to the enamel, and go to the contact point. You notice that we're doing very careful, small strokes, overlapping, starting near the CEJ here or on the enamel in the supragingival area. Overlapping strokes when we get to the interproximal or onto the distal
Here's
surface
an
of this
extreme
lateral.
close-up of the large 867
Continue doing the
sickle
distal
scaler.
surfaces.
I'm in a back
These are the
position doing the
surfaces.
surfaces
Now I'm in a back
away.
position. I'm going to position
so
the
we
mirror
start
to
at the
scale
midline
the
and then
lingual
rotate the
surfaces
tip
away
around.
from me with the
We're just doing
H67
supragingival
sickle
scaling
scaler.
on the enamel.
So I'll line this instrument
Go
up
to the next tooth,
with the
start
long
at the
axis of the
midline.
tooth here.
Just use the first
Start on the lingual
millimeter or
and do
two
the
of this
mesial
very
of the
sharp
canine.
pointed instrument. Stay on the enamel supragingivally to the contact point. We'll do another one here. Start near the midline. Rotate, keep rolling this. Keep it against the tooth as you go interproximally or on this surface. We're going to do all the surfaces away.
Here's a close-up of an anterior Jacquet sickle. We're going to start on the midline. We're in a back position. We're doing surfaces away. So we're doing up to the contact. We'll do the next tooth. Start at the midline. Do short overlapping supragingival strokes. This is for the removal of supragingival calculus to the contact point. And we'll do the last tooth. We'll do this one for the demonstration, but you should continue scaling all of the surfaces away from you to the canine. To use the H67 anterior sickle, we're going to start on the surfaces toward us. So I'm in an 8 o'clock position, and you use your index finger like this to retract the lip. I'm going to take that away and establish a fulcrum here on the occlusal surfaces of the premolars, and we'll start on the mesial of the left canine. This is a supragingival instrument primarily, so we're going to work on the enamel here and bring the tip of this up into the contact, especially if there's some supragingival calculus here or some subgingival calculus. If there's heavy subgingival calculus in this area, sometimes the tissue is loose enough that you can insert this a little bit under the tissue, but it's quite a big instrument, a big heavy instrument, and so you can cause trauma if you are not careful. So upright the handle and the shank of the instrument so that you open the angulation up to 80 to 90 degrees. And then as you come to the contact area, let me show you this again in the anterior area. As you do your strokes up into the contact, if you move your handle out away from the face, it will move the tip up like this, and then you can get a little more into the contact area. To get under the contact, of course, you need to upright your handle and your shank to get fully under the contact. As you come near the contact, move your handle away from the face and do a series of oblique strokes like this up into the contact area, and finish by using the point of this instrument right at the contact. To scale the surfaces toward you with the H67, get your mirror in place and then upright the handle and shank and adapt this blade to the lingual mesial of the left canine. We're doing the surfaces toward us now from the lingual aspect. Lead with the lower third of the sickle blade here and go all the way to the contact. Go to the next tooth. Get this blade just under the tissue to get under the either the supragingival calculus, or sometimes the subgingival calculus extends and is continuous with the supra. So get under it and then get your lower shank really parallel so you have 80 to 90 degree angulation. And we're moving along and doing all of the surfaces toward us, toward our body, from the lingual aspect, looking in the mirror. Now, if you can look over the teeth here and look with direct vision, and so your mirror would be just retracting the tongue and adding extra light in the area. But if you can, just make sure that the point of this H67 goes all the way to the contact and up. Sickle blade.
And we're going to start on one of these teeth right at the midline. If there's calculus here, you're going to get under the supragingival calculus and do a stroke to get started, and then rotate around. Keep the shank and the handle really upright so that you can do a series of strokes to remove the supragingival calculus from the enamel here. We'll do another tooth. Start at the midline. Use your wrist motion to bring the blade up. You're going to use your thumb from this front position to adapt the blade and adapt the pressure against the enamel, and do the supragingival calculus scaling like that. Here's an extreme close-up of an anterior sickle on the surfaces toward me. I'm going to start at the midline and do a series of overlapping strokes into the mesial and up to the contact. We'll do another tooth. Start at the midline, use the first few millimeters of the blade to contact the mesial surface here. Do overlapping strokes. We'll do one more. Start on the midline. Make sure this very sharp point is always against the tooth as you. Now I've moved to a back position, 1 o'clock, to do the surfaces away on the lower anteriors. I'm using my index finger to retract the lip, and I'm going to take that away. So now we have this H6-7 and doing surfaces away from me. I'm going to start on the midline and rotate around and do overlapping strokes across the mesial up to the contact area. We'll do the next tooth. We'll start on the midline, do overlapping strokes, rotate at the line angle, and do overlapping strokes up to the contact. Do one last tooth. Start on the facial, overlapping strokes, rotate. Try to upright this. If you have calculus, you're going to want to keep this blade more open to an 80-degree angulation, and then go up to the contact. Now I'm in the back position, and I'm going to use the mirror here to show you how to scale the surfaces away from you with this H6-7 from the back position. I'm going to place the mirror in here, and then I'm looking with direct vision, but the mirror gives me extra light, extra illumination, and then we're going to start on the mesial of the right canine, and these are all the surfaces away from. Extreme close-up of the H6-7 instrument. I'm coming in from a back position to scale the lingual surfaces, and I'm scaling the surfaces away from me. This is a quite large sickle, but we're going to start on the lingual, and usually you use this when there's a lot of supragingival calculus here, especially along the cingulum and on the lingual surfaces of these lower anterior teeth. So you take the first 2 millimeters of this, start somewhere near the center, and use a series of strokes, overlapping strokes like this on the surface, and you rock against your fulcrum to use leverage to bring the instrument up. Rotate so you don't poke into the tissue, and then use the point all the way up into the contact area. Now, when you use this, make sure that you are not using too much of the blade. When you start, you're going to start with 1 millimeter or 2 of it. As you go interproximally, under the calculus, you can use a little more of the blade, but concentrate your pressure toward the lower third of the blade, and then use overlapping strokes. Now, at this point, when you're interproximal, if you've got calculus, you want to upright the handle and the shank so that you come close to 80 to 90 degree angulation as you come up. If the tissue is tight and there's just a little bit of calculus here, you're going to try to close the angulation by leaning in toward the tooth so that you don't traumatize the tissue, and kind of angle this up if there isn't a lot of pocket depth.